Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you on a Sunday night for our Monday morning dictations. I'm going to talk tonight about migraine headaches. As you know, headaches are probably the second most common reason people come to a doctor, a family doc at least, and certainly neurology, probably number one. But anyway, migraine headaches have been very misunderstood over the years. We used to think that migraine headaches were just caused by dilation of blood vessels, cerebral blood vessels in the brain. Now we know that there's other factors involved, like chemical messengers and things. That's why there's a couple new drugs, more than a couple, to treat very adequately migraine headaches, which are very difficult to treat through the years. I remember when I first started practicing medicine 35 years ago, somebody would come in with a bad migraine. We'd have to give them a shot of Demerol and Phenergan, knock them out, send them home with somebody where they could sleep it off for a day or two. But when a new class of medicines called triptans came to play, the first one was Imitrex. I'll never forget my first recurrent migraine patient that I treated with this. And I'd have to knock them out. This reversed their headache in about 5 or 10 minutes. They walked out, without a trace of a headache. So that was a remarkable treatment. And now there's a couple new ones out that may be probably even better than the triptans and not carry the risk of the triptans. The triptans constrict the vessels. In certain people that can be an issue with if they have cardiovascular disease or hypertension. So certainly the new class of medicines is much safer. And so keep your ear peeled about that. We're already using it in our office, and it's working quite well. But anyway, of course, there's a lot of different types of headaches. Probably the most common headache's a tension headache, and then migraines, sinus headaches. But, and especially in East Tennessee, we blame a lot of stuff on sinuses, but I think a lot of those sinus headaches are really migraine headaches. I think migraines are very underdiagnosed and being put off as sinus headaches, or maybe even tension headaches. You have rebound headaches where you're used to taking so many Tylenol or ibuprofen, you don't take them, you rebound, you get a headache. And then cluster headaches, which is a really severe form of headache where it's probably the worst type of headache that I see. They're not as common, but when you see one, you'll never forget it because it's like a hot poking iron is sticking into your eye. And you get a lot of, it's usually almost always one-sided around an eye. The eye will turn red. You'll have a lot of tearing and your nose will start running. And they come in clusters of, they're very short duration, but they come in clusters of a few days at a time, so those can be challenging to treat as well. But anyway, a migraine, usually it's that headache that we call a sick headache. It's usually one-sided, not always. It's throbbing. It's going to be associated with nausea and vomiting, visual disturbances. And, it's a headache that you hear people going to bed with because it's that severe and debilitating. There's two types, with an aura, which is a kind of, an aura is something that a sensation that this migraine is going to come on. So before the headache, you can have flashing lights or you can have different smells. You can have different sensation, numbness, tingling, that type of thing. But usually it's a visual aura. And then you can have without an aura or a cognition that it's coming. But in either way, they're both very treatable now, especially with the new medicines. There's even when you talk about treating an acute migraine, it's different than talking about prevention of migraines. There's a couple, or I think 3 new monthly shots that you can get. Usually have to go through a neurologist because they're very expensive and have to go through all this rigmarole to get them, but it's available, and it can, through this once-a-month shot, decrease the amount of headaches that you get. So you need to have at least 4 to 15 migraines a month to really qualify. Then you have to try all the other medicines first and get a prior approval. But so there are those. There's also other medicines that we've used for years, like calcium channel blockers, like verapamil, that we can take for prevention. Sometimes we use beta blockers like Inderal. And now we use more Topamax, which is actually a medicine for seizures. We also use it sometimes for weight loss. But